Good. Akash, over to you. I think that, a really same question because I'm just trying to understand a bit or give a flavor about the ecosystem, right? What is the biggest bottleneck in getting healthcare providers and systems to adopt new technologies in India?
So, Helen, when I was on the physician and the healthcare provider side and used to hang out with my tech friends, we were really seduced by what tech could do. And the conversation was pretty much along the lines of, can we just get these doctors and nurses out of the way and we can transform the healthcare ecosystem? Just give it to us techies and we'll change the world, right? And then when I started hanging out with the tech guys a lot more, I realized I kept telling them, you can't do that. You don't understand why the doctor's doing this. So it's really very complex, and we would love for Steve Jobs to come and just transform the healthcare experience. It doesn't work quite like that, and that's primarily because healthcare is a very, very complex ecosystem. And let me just give you an example. If you or me or any of us walks into a hospital, right, and just draw a map of all the stakeholders around there, the physician, the nurse, the CFO of the hospital, the CEO of the hospital, the insurer, the pharmaceutical company, the diagnostics company, all of them want you to get healthier. Of course, that's a given. But all of them have different incentives on a day-to-day basis, right? So I think one of the biggest bottlenecks to adoption is that very often innovations are designed in very closed, siloed environments, and they don't really think through what's the value proposition of this for every stakeholder around the table. That is the biggest bottleneck. I've become a little less cavalier in blaming doctors for being Luddites and not adopting technology. I've begun to appreciate a little bit more that I need to give them a value proposition if I really want them to change their behavior. And I think some of the new age companies that are really thinking through the UI UX for everybody, not just the patients, are beginning to crack that. But it's still a high